So now we have our alcohol use disorders. Looking at our signs and symptoms of alcohol withdrawal, we have our CNS excitation, where we have the tachycardia, hypertension, nausea, vomiting. We will have a low blood glucose. My students usually struggle with this because they know that alcohol usually has a lot of empty carbs in them, but because of how it manifests through the body and through the liver, it actually causes a low blood glucose. We are at increased risk for seizures and hallucinations. We are going to use seizure precautions. We're going to give benzos, one specifically because it is such a long-acting benzo. We're going to give chlorodiazepoxide. And even though this one doesn't end in PAM or LAM like our others do, I teach my students it does have diazo in the middle of it, just like diazepam. So maybe be able to recognize it. We can get those fluid and electrolyte disorders, especially with chronic use, but even with short-term withdrawal use, we're going to have that as well. And hypothermia, we're not going to be able to regulate our body temperature as well when we're going through this. Looking at signs of chronic alcohol use disorders, we're looking at liver problems. That's going to be our cirrhosis. We've got to have to look at those liver issues. We're not going to be able to process meds and things. Neuropathy, pancreatitis, AFib, low potassium. Another thing that it can do is it can eat away at our thiamine level, which is our B1, and that is called Wernicke-Korsakoff syndrome. This is caused by a low thiamine. And your telltale sign is going to be things like confusion, ataxia, which is your poor coordination, nystagmus, which is that movement of the eyes. Those are going to be kind of your telltale signs with that. So we need to be mindful of that. And then looking at our screening tools, I have inserted a couple of examples of these. They may look a little different depending on where you go. And remember, I'd never expect you to memorize a screening tool in its entirety. I just want you to know what it's for. So there's Michigan alcohol screening. There's also the CAGE questionnaire. CAGE questionnaire is just looking at how you feel about your drinking. And then the big ones are going to be alcohol, CIWA, Clinical Institute Withdrawal Assessment of Alcohol. This is going to be watching for those signs of alcohol withdrawal to know if we need to give a dose of a benzo or not. So you'll kind of see that, and it gives you, it kind of tells you what your scoring is and what to do. And then we also have our COWS, which is our clinical opioid scale. Same concept. You look at all those different pieces and it tells you what we need to do as far as the results. And typically your order will have complete a CIWA every 4 hours and then give you, just like with like a sliding scale for insulin, it'll give you a sliding scale for a score 0 to this, do this, for 5 to 8, do this. So you'll see that. So now we have our stimulants versus our downers. Our stimulants are going to be things like amphetamines, cocaine, can be hallucinogenics, things like that. We're going to have manifestations of hallucinations, seizures, extreme fever. We can have tachycardia and hypertension. That can lead to chest pain and cardiovascular collapse, which can cause death. So we do need to monitor their heart, especially when they're withdrawing. When somebody is coming off of a stimulant, we're probably going to give them a downer, kind of like a benzo. So we're going to give them a benzo to start. but then what's going to happen is when they start crashing, we're going to talk about this in a second, but it's not going to make you, it's not deadly like alcohol detox is, but it does cause the symptoms are so bad they make you wish you were dead and cause that suicidal ideation and depression. So we're going to start with a benzo. I cannot write with this, so I'm just going to speak it. We're going to start with a benzo, and then we're going to counteract that depression with an antidepressant. When we're looking at our benzodiazepines and our opioids, those are going to be your downers. So we're going to have drowsiness, sedation. We can have some agitation, slurred speech, lack of coordination, nystagmus, disorientation, nausea, vomiting. We can have that respiratory depression, which can decrease our levels of consciousness and can be fatal. For opioids, we have our antidote, which is naloxone, and for benzos, we have our antidote, which is flumazenil. One thing to be mindful of is for our opioids, looking at our triad that we remember should be pinpoint pupils, respiratory depression, coma. So going back to alcohol withdrawal, looking at our medications, we're going to use benzodiazepines for withdrawal. We already talked about that. For abstinence, once we've withdrawn and we actually want to stop using alcohol, we have our disulfiram, which is our antabuse. This medication will make you very, very sick if you have alcohol, and it can kill you. So we are worried about that. And with that, our body doesn't care if it's alcohol from a drink or alcohol from mouthwash. So we have to be mindful of any hidden alcohol in everyday objects like mouthwash, hot sauces, hand sanitizer, medicines, things like that. And then we have naltrexone, which is going to decrease the cravings and the pleasurable effects of alcohol. And then we have our acamprosate, which is going to decrease the effects of not having it. So kind of decrease some of those withdrawal effects, the sweating, the anxiety, the restlessness. It can cause diarrhea, so we want to take it with food to try to prevent that and stay well hydrated. And then looking at our opioid withdrawal, this, just like our uppers, the side effects of coming off are not deadly, but can cause SI, so we may give them the naloxone and an antidepressant to go with it. Just like with the stimulant, we're going to give them a benzo to calm them down and then an antidepressant to chill them out. As far as withdrawal and abstinence goes, we have methadone, which the goal is to prevent withdrawal symptoms. But our dependency to methadone is going to replace our dependency to illegal opioids. We have clonidine, which is going to mask the effects of withdrawal, but it does not reduce the cravings. And buprenorphine, this is your Suboxone. It is considered safer than methadone because it has it's a opioid agonist antagonist. So it has that antagonist in it to help prevent overdose. And that is it. And I've put some other little inserts in there. ATI didn't have some of these substance use drug cards, so I made some of my own for you to have and to look at. And then in the back, there is just some overall anxiety and mental health disorders that kind of just briefly sums it all up.